Okay, welcome back to another episode of the Cancer-Free Reality Show. My name is David D. And my last episode, I was telling you that we went to go see a local cancer doctor here in the area, and he was saying that there was a low shortage of bleomycin. I believe that's the name of what it's called, bleomycin. And that I had to go down to Charleston to talk to a doctor down there that he recommended. And so we did. We went down to Charleston. We talked to the doctor down there. They took blood work. I mean, I've been stuck with so many needles. I'm like a human pincushion right now. But the good thing is I heal fast, as you can see. Well, there's a little bit of mark there, but with all these, they took 7 vials of blood down there too, and I guess they need it for all these different tests that they conduct to see where my blood counts are and things like that. So we waited a long time to see the doctor. They had to pencil us in because he was going out of town. That was fine, but and then when we got to talk to him, he was very relaxed, even though he saw a bunch of patients and it was at the end of the day. He took the time to talk to us and had a real good bedside manner, which was good. You don't see that in a lot of doctors today. They just want to get you in and get you out, Everything going okay? Good. Here's your prescription. Take off. And but this doctor was good. He was able to answer a lot of our questions, which, of course, we didn't have a whole heck of a lot, I mean, this is all new to us, so we just take the information he gives us, and then, we have questions later. So we talked to him about the bleomycin, that there was, quote-unquote, a shortage up here in Myrtle Beach, and he kind of scratched his head about that. He wasn't familiar with that. He didn't know anything about a shortage, but there was plenty down there in MUSC. The other thing he talked about was that he was a control freak, and that he wanted to do all the treatments by himself, and he didn't want to split up the treatments between 2 different doctors because there's too much information that can get shuffled and miscommunicated. And so we took that in stride, and we said, okay, well, that makes sense. Splitting up between 2 doctors is difficult, and God knows how many times paperwork gets lost in the shuffle and so forth. So it was better that he would have direct access to all the files, and we would just do the treatments with him. He said that the treatments that he conducts are 9 weeks worth of treatments. There would be 1 long week where I would be having 5 days of chemotherapy, between 5 to 6 hours a day, which is just insane. And then that would be for 5 days, and then a short week would be like the Monday after the weekend. And then I would be off of chemo for about maybe 6 days, and then have another short week, which would be the Monday, and then another long week, and those 3 different cycles of that. So that was interesting, which meant we needed to get room and board down there in Charleston because it's such a long drive, especially for those long weeks. So. But we decided, he used the comparison of if I had a brand new BMW, and which I don't yet, and if I bought a brand new BMW, I would not take it to a regular mechanic that can work on all sorts of cars. You would bring it to a BMW dealer. So when he used that comparison, and I asked him a bunch of questions about, how many patients has he seen, you know, especially with testicular cancer and things like that. And I would say, I believe he said over the last 2 years he did maybe, you know, 7 or 8 patients with testicular cancer. And that's just down in MUSC, but he's also seen other patients, I think up to 35. I can't remember. Again, there's so much information going around in my head, it's hard to stay focused. So, as you can see, I haven't started the treatments yet. I have all my hair. And I was wondering, I had this perspective that, you know, because I was told by the urologist that testicular cancer is very sensitive to the chemotherapy. So in my mind, and my perspective was, okay, well, if it's sensitive, then it's not going to be the full chemo treatment, like, you know, 12 weeks, 16 weeks, you know, 3 months, whatever. And that it would just be, you know, a short term. I would knock it out and we would be done. Well, according to him, that's not the case. What he does is he's very thorough. He wants to knock it out. Why would you only go halfway through the treatment and you know, and then stop? So he wants to be fully assured that it's all gone, and you know, this is what he does for a living. So I couldn't argue with him. Some of the drugs that he's going to prescribe, obviously, is the bleomycin. The side effects are fever and chills, darken of the skin, thickened nail beds, mild nausea and vomiting. Not looking forward to that, but they are going to give me prescription drugs for the nausea and the vomiting. Hopefully, we'll keep up on that. Etoposide, VP-16. It's another drug which is going to lower the white blood cell count, the low platelets, hair loss. Usually not permanent, is what they're saying. Obviously, the nausea and the vomiting and stuff like that, but and then, you know, could cause mouth sores and everything like that. So I'm not looking forward to this treatment. And then the other drug is cisplatin, or platinol, is what it's also called. Moderate to severe nausea and vomiting. Jeez. Numbness, tingling, burning in the hands and feet, damage to the kidneys, possible. Low blood count, red blood counts, blood cell count. So ringing in the ears, etc. So yeah, it's interesting. You know, cancer can kill you, but you know, sometimes I wonder if the drugs can too. But according to them, you know, they're the experts and they know what they're doing, and it's been proven that those drugs work for this particular type of cancer. So we're going to go ahead, you know, and move forward with that, and that's the information I have so far. And you know, on my next episode, I don't know, we'll just talk about, you know, the next step, what's going on and what we're going to do. So we'll talk to you later. Don't forget to check out my website at cancerfreetreatment.com. That's cancerfreetreatment.com. And I've got plenty of resources there for you to maybe help you out and point you in the right direction and give you some more information about testicular cancer and the other types of things going on. So thanks again. My name is David G, and I'll talk to you soon on the other side. Thanks.